So the Fair Playing Field Review came out of an amendment tabled by Lord Patel of Bradford in the House of Lords. And that amendment specified that within a year of the passage of the Health and Social Care Act, the Secretary of State will report back to Parliament on the barriers and differences between provider organisations participating fully in improving patient care. And so what we used the review to do would both establish some factual basis to understand what kinds of different barriers provider organisations face, but also make some recommendations to see how we could reduce or eliminate those barriers in future years. So the important thing to say here is that it's for commissioners to determine where competition is and isn't used within a framework of overall rules. And so what Monitor will do is Monitor will sort of supervise or regulate the system, observing where those rules are breached and where they're breached, ensuring that we pursue effective and also targeted enforcement activity. I think there are a range of ways in which providers will benefit from the recommendations of the Fair Playing Field Review. I'll give you one example which I think will affect the voluntary sector, and that is at the moment the voluntary sector feel that they are required to have demonstrate excessive working capital or excessive track records of performance. That's incredibly difficult for new organisations, staff-led, spun-out social enterprises, or organisations that are used to doing other things in other areas but don't have big capital bases to rely on. And so we think what's important is that commissioners are helped to understand what the appropriate levels of working capital are, so they don't make disproportionate requirements and therefore don't exclude the smaller charities that we think could make a real difference at a local level to the provision of NHS services. So Monitor's primary duty is to protect and promote patients' interests, and we'll do that through a range of different mechanisms. The most obvious is the extension of our existing responsibilities, but codified within the licensing system. It's absolutely critical that Monitor continues to keep a high bar on the assessment of NHS trusts and continues to ensure that foundation trusts are well led and well governed. But there's a range of different tools, as I say, that we'll pursue. Within the area of competition in particular, I think that Monitor will want to provide clear guidance to commissioners and provider organisations about what the rules really are, and make sure that we enforce those rules in a pragmatic and flexible way, a way that doesn't frustrate attempts to integrate or coordinate care, but at the same time ensures that that we protect patients against anti-competitive behaviour and ensure that they, where appropriate and where possible, have choices between the providers they use.